Well, good evening, everyone, and welcome to a special meeting of Belleville City Council as we hold our Community Policing and Mental Health Forum. And on behalf of all of us at Belleville City Council, I'd like to welcome you all. Because of rules under the Municipal Act, we have to follow a certain procedure. And before I turn it over to Councillor Millette for the public portion of this, I have to dispense with some business. So I will call the meeting to order, and I will note that myself, Councillor Alsap, Councillor Paul Carr, Councillor Sean Kelly, Councillor Chris Millette, Councillor Kelly McCaw, Councillor Garnet Thompson, and Councillor Ryan Williams are in attendance, and therefore we have quorum. I also will say that we are going to dispense with the following items on our regular agenda. Items number 2, 5, 6, 7, 8A, B, C, and D. Item number 9, 10, 11, 12, and 13. With that, we'll move into the public meeting portion of this evening's meeting, a public forum on policing and mental health, discussing how police services can further develop ways to work with and alongside our community to address addictions and mental health in our community. And it's my pleasure now to pass it on to Councillor Chris Millette for the remainder of the meeting.
Thank you, Your Worship, and welcome everyone. Thank you, firstly, to our panelists for accepting the invitation to speak to us tonight about your shared experiences in the field. We have a broad range of police and mental health and addictions officials with us tonight. So broad, in fact, that we are going to try and keep it moving along quite briskly. So without further ado, I'm going to call on, first off, Detective Sergeant Carla Stacy, Kingston Police. Detective Sergeant Stacy is with Kingston Police Investigative Services Division, Fraud Vulnerable Sector, Kingston Police. And I understand yourself and Robin Witzke from Addictions and Mental Health Services, KFLNA, are going to speak about the MCERT program with Kingston Police, and it's been underway for some time. You have the floor, Sergeant Stacy.
Hi, thank you. Yeah, so I'm with the Vulnerable Sector Unit with Kingston Police. And for about a year now, we have been working with addictions and mental health in a program called MCERT. MCERT stands for Mobile Crisis Rapid Response Team. And that is a program whereby we have police officers on the road with a little bit of specialized training with addictions and mental health workers riding together. And they do patrols together in the same car, and officers assigned to those units would be dispatched through our communications to calls for service regarding individuals that have mental health issues. And so when the officers are attending those calls, the mental health workers with them are able to add their expertise right on the spot with whatever's going on. So for us, that means that they're able to manage a little bit faster, or the services provided are, expedited a little bit more so than if we have to wait, for example, the next day to make a referral. Addictions and mental health are able to utilize resources that they have available to them very quickly, like their safe bed program, connections to workers assigned to individuals particularly can be notified a lot faster. So for us, it just means that officers on the road have that expertise in the car with them when they're answering those calls that are a little bit more challenging because of the mental health element to it. So that's the MCERT side. We also have, in addition to that, it's COAST. And COAST is our Crisis Outreach and Response Team. And that is a detective that's assigned to follow up from calls that we receive on the road. And again, working with addictions and mental health for those more challenging individuals that need a little bit more time and assistance in getting connected, or, out to resources that they need, individuals that maybe have never been in connection with addictions and mental health services that we, and as police officers, come across on a regular basis. And so collectively, the police and addictions mental health are working in these two programs to offer better and more specialized service for individuals.
Quick question, Sergeant Stacy.
I think that kind of summarizes.
Yep, that's fine. And I'm going to go to Robin in just a second. I understand there's some measurable results as of the program being in place for what, the past year or more?
Since October
Just over a
of
year,
2019. Yeah.
Okay, so statistically, has there been any reduction in arrests or any measurable numbers of different outcomes? I believe I was speaking with another officer who said that some results are in that respect.
So our methods of collecting the data on that have changed in the last little while. As of late last year, we implemented a program called Health IM, and it enables us to track a little bit more information, such as how much time the officers spend at the hospital, or how many calls for service we have, how many apprehensions as opposed to not. And I, as the supervisor in vulnerable sector, monitor all of the mental health. I don't have access to them today. However, I can tell you that I do see a reduction in, for example, the amount of apprehensions. Because addictions and mental health are working with us directly, then we're able to offer other options for individuals where otherwise we wouldn't have them because they're right there with us to access. I can say that our wait times at the hospital are significantly less. I don't know that the calls for service have changed, to be honest with you, because of COVID. Obviously, there's a lot more stress right now. So it's hard for us to put a real accurate number on it right now, but definitely in the calls that I read, whereas before our options were limited in regards to what the officer could do with an individual who was having a problem on a particular day. Now there are more options for them. So there's less like quick apprehensions and stuff like that on part of officers because they feel limited in what they're able to do. So I definitely see when I'm reading the calls, having the addictions mental health workers in the car as being a huge benefit to services that we can provide.
Great. And Ms. Witzke, can you tell me just briefly what the impetus was for KFL&A addiction service, mental health, and to get involved, or how did it come about, this relationship?
Yeah, I think, I mean, I guess I'm trying to remember back, it was sort of, we had been discussing it for quite a few years before we were actually able to implement, just due to sort of our internal resources. We had to repurpose. We had been had crisis workers in the hospital, but it was sort of a duplication with social work. So we found some funding we were able to put into it. I think it was, I mean, it was sort of coming from both sides, right? We wanted more of a working relationship with police, so we could support people with mental health calls. And yeah, I think in terms of from the policing side of things, I mean, Carla could maybe speak better to that, but I think just there were a lot of calls that they were responding to that really required a mental health response, not a police officer response. So yeah, so that's sort of how it all started. Sorry, go ahead, Carla.
I was just going to add very quickly there. So we had applied for a grant a few years back with the intentions of doing this MCERT Coast model. And it was modeled after Hamilton Police. Hamilton has Coast and MCERT established in their community where the workers and the police work right out of the hospital there. And so we had attended there and gotten some information about how they do that, and then applied for a grant in order to implement it at Kingston Police. And when we did that and we secured the grant, we reached out to Addictions and Mental Health, and they were very eager to be part of the program. And so from there, we just basically, moved forward to get this thing going very, very quickly and very enthusiastically.
Yeah, so I guess in terms of what I might add to what Carla mentioned is what we found to be really important is having a multi-tiered response. So Carla talked about the Mobile Crisis Rapid Response Team, which is a response directly to 911 calls. And then we have COAST, which is the plainclothes police officer responding with a crisis worker. And that's more of a follow-up to other calls to do some follow-up work. But what we're also trying to sort of build into the mix is just a better relationship with our crisis teams so that we can actually take over completely some of the calls. So we've been working a little bit with dispatch when they have calls coming in that don't actually require police response at all. They can pass those calls on just directly to our crisis team, and then 2 crisis workers can respond without police to sort of alleviate the stress on police and get the best supports available. Also, just in terms of something to sort of keep in mind when looking at like implementing similar type programs, what we've found is, because we're actually, Addiction and Mental Health Services is for Kingston, Frontenac, Lennox, and Addington. So Scott Semple is going to be talking a little bit more to that. But what we have found is that just depending on sort of the geography that you're looking at, the response can look quite a bit different. So in Kingston, because the Kingston area, we're really just looking at city of Kingston. The 911 response really makes sense to implement that. But in Napanee, we chose to do things just a little bit differently, where we do have a crisis worker that's working at the OPP station and can do more of the follow-up calls. They're not really doing the 911 calls, because to have somebody in a car in such a large geography, they wouldn't likely be in the right place at the right time to respond directly to those 911 calls. So we've sort of done something a little bit differently in LNA, as well as in Frontenac. With Frontenac OPP, we do have a transitional case manager. So they sort of do the crisis response similar to in Napanee, but they also can do the case management work and continue to work with the person who has the mental health and or addiction issues. So just some things to kind of contemplate in terms of implementing programs, just really looking at and making it work for the community, because it's not sort of one size fits all. Sort of what worked in Hamilton didn't exactly work here and might not exactly work in Napanee or in any other community. So.
All right, thanks very much. Just a quick question for Sergeant Stacy, and then we'll move on to Inspector Semple. Sergeant Stacy, how many workers do you have in the MCERT program at any given time?
So I can actually answer that question, because we had
I think in total.
So we had 4 briefly through the, we got some additional COVID funding. So we were able to follow 4 platoons with 4 workers and cover off the 24/7. Unfortunately, that was just sort of temporary funding. So we're going back to 3 workers. And so we're able to cover 7 days a week, 18 hours. So from 7 in the morning until midnight.
And we have probably right now, maybe a dozen police officers that have gone through the MCERT training through Hamilton in the last couple of years that are able to, we have a couple that are mostly used because there's a preference, and then on their part, and then afterwards we have other officers that are able to pair up with addictions and mental health when the original officers are not available.
Okay, great. Well, thanks very much. And I'm sorry we don't have much more time, because it's interesting, but I think as you mentioned, Inspector Semple may have similar comments. So thanks very much, Carla and Robin, and Inspector Semple.
Well, good evening, everybody. It's a pleasure to be here. Known about this happening for a while, and it's finally here. Chris had contacted me quite some time ago. And I'm always excited to talk about our mental health program. I'm quite proud of what we've been able to accomplish. I must first say that, I do understand why people refer to us as Napanee. This detachment that I run was referred to as Napanee OPP for many, many years. One thing I did do 2 years ago was change the name, and we're now LNA County OPP. And part of that is, as you've heard, we're part of KFLNA in a lot of ways. And certainly mental health is one of those ways, where it's Kingston, Frontenac, Lennox, and Addington County. So in LA County, just so people have a perspective of the differences between, even if within KFLNA, as Robin and Carla were speaking of, we are a rural police service. You know, we service 300,000 hectares, 45 to 50,000 people, goes up to over 60 in the summer, but it's a very, very large area. We service 4 municipalities in LA County, but we also service Tyonega Township in Hastings in the town of Deseronto, and we also support Tyonega Police Service. So we basically police between the city of Kingston and the city of Belleville, and then all the way up to Denbigh, Renfrew line. So it's very large. So when we first talked about programming to provide mental health support to our front line, you know, we've heard about the Coast Model and things going on around the province, and became very aware of these things happening, and we had to try to find something that would fit the type of policing we provide. And we decided that, and we actually named it a little bit different than Kingston. We went with what's called an MCIT, so my Mobile Crisis Intervention Team. It didn't make sense, as was spoken to by Robin, for us to have a mental health worker driving around our vast area in a cruiser waiting for a mental health call. Even though we are quite busy in the south end of our detachment area, it just didn't seem to warrant having somebody driving around waiting for a call. So we have a full-time mental health worker in our detachment embedded, and they do go out and do remote response when required. So frontline would attend a call, ensure that it's safe for the worker to attend, and then rely on the worker to come in and do some either de-escalation or referral or connection to services, which may not always be mental health. It could be social services, could be housing, could be a variety of risk factors that are contributing to the person's crisis. So we find that this is working quite well. And on their downtime, when they aren't out responding remotely, they're following up. There's an officer assigned to work with them as part of the team. So they will look at calls for service that have come in overnight or on days that they weren't there on the weekends, and then do follow up with people that we see are entering crisis, that we can maybe do a better job connecting them to services and either get them out of crisis, or we can go and prevent a crisis from happening when we see some risk factors creeping up on us. So my goal as a detachment commander was simply to look at, and I'm sure Chief Callahan will agree, and Inspector Meeks and Carla that are in policing, our number one goal is really to reduce the burden on policing that mental health has created. And, you know, it is something that eats up a lot of our time and resources. And we also, the second outcome we're looking for is just that, better outcomes for people that need us. And to try to break the cycle of reliance on the police to deliver mental health services, we aren't the appropriate service for that. We obviously are there to help people in crisis, either to transport them to hospital, or, you know, traditionally that's what we did. We apprehended, we took people to hospital. Well, you can imagine the burden that places upon emergency rooms with people showing up in cuffs by the police, and then they don't truly understand, well, why is this person here? Are they under arrest, or have they been apprehended? And it actually sometimes creates tension with our partner in the health sector, not really knowing, you know, why are we bringing these people into emerge? I can't say we're at a point yet where we're not apprehending people and taking them to emerge, but I can tell you, I'm happy to report with these programs, I think we're doing a much better job bringing people that actually require hospitalization and the services in an emergency room by, you know, referring people, keeping them in situ, giving them support, and getting them connected to the people that can help them move on with their life, whether it's a mental health crisis or addictions issues. So again, our program is something that I lobbied for many years. You know, we didn't follow a model of funding it through grants. Our model is funded through a partnership with Addictions and Mental Health, which for me was important because it provides sustainability. And it has to be something that, you know, we support mental health to go to the LIN and get funding for these things, because they truly are an investment. And they do reduce the pressure on policing which, as everybody knows, especially as members of council, how costly policing is, and using those resources for things that we can better get ahead of in the community and support in a better way, like I said, with much better outcomes, and breaking the cycle of of us having to attend the same place over and over and over again, which really isn't something that even our members want to do. They feel, they really aren't the right service to go. They don't feel like they're providing anything. They can't obviously provide much in the way of services to those people other than, like I said, apprehend them and take them to the hospital. So our people in general are absolutely 100% behind this program. We've had it for almost a year now. It's been a tremendous success to the point where, we believe we need more capacity to provide it. And we're in talks with Addictions Mental Health to do that. But we're also expanding that to look at, well, what puts pressure on these calls for service, and maybe approaching other partners like social services and housing in particular, or approaching even our EMS partners to say, can this be a joint program where we can combine some resources and provide even better care to people, especially during COVID, where we have a lot of people in isolation, and we maybe need to start going out and seeing people before they enter crisis. We know who they are. We know that they struggle from time to time, and we could maybe do a better job going to them and preventing the crisis. And like I like to say, right now it's about reducing repetitive calls for service, but I think we have to actually move it further forward upstream and start to get rid of the actual first call for service by providing better supports to people that go into crisis. So I probably went over my time, but I tried to go quickly. So if there's any questions, I'm happy to take them.
What I would like to do is at the end of this hour, if any of our counselors have any questions for individual speakers, I would ask them to possibly scribble them down or keep note of them. And we'll ask if anybody has a question, and we'll address those at the end. So thanks very much, Scott. We'll move right now to Chief Callahan and Inspector Meeks, Belleville Police.
Thanks very much, Councillor. I completely agree with our OPP counterparts and our partners in Kingston as well. And I think that we need to put a little bit of context into the issue that we're dealing with today. And just to follow up on that, the real important thing here is the collaboration that we have between our mental health partners and our addictions and mental health partners. And we're very, very fortunate to have such a sound foundation to build on as we move forward. There are certainly opportunities for us to do things more effectively and more efficiently. And at the end of the day, what we're trying to do is ensure that individuals in our community that are in mental health crisis or addiction crisis, that we're getting the right resources at the right time to support these individuals. And I think it's important to note that when we look at this, this is truly a societal problem. It's just not a policing problem, or it's not a Ministry of Health problem. It's a societal problem that we need to support. And I think that with a very, very strong collaborative effort and working together and pooling those resources, as you were just talking about, Scott, it's going to make a significant difference in the outcome of what we're trying to accomplish. One thing I would suggest, if people haven't had the opportunity to read the Graham report, it's dated, but it's actually very, very relevant to what we're talking about, because when it was introduced in 1988 and then implemented in 1993 and 1994, there was originally supposed to be a significant amount of resources to be able to help individuals that were transitioning from mental health care facilities into community settings. And it's always been a challenge to make sure that we have sufficient resources to do that, but it really puts context to what it is that we're dealing with. Obviously, in policing, we want to be part of the solution, not part of the problem. And when we look at calls for service, as you alluded to a few minutes ago, Scott, we're right now looking at over 40% of all of our calls are indirect or directly or indirectly related to mental health calls. So what we've seen actually, even from 2019 to 2020 in Belleville, we've had a 27% increase in our mental health calls for service. In a couple of minutes, Inspector Meeks will talk about the Health IM program that's been instituted and has some statistics to show the support and the impact that that's made. I think it's important too that we talk as well about the de-escalation training that we're providing to all of our officers to ensure that, as you had spoken about, Carla, that when we're dealing with these individuals, we not only understand the crisis that they're going through, but also what it is we can do to assist them, and being in a non-confrontational form, because we know the uniform itself can agitate some individuals in crisis. One program that's very, very interesting is the Cahoots Model out of Eugene, Oregon, and it's very similar. That's kind of a hybrid to what the OPP in Kingston are using, and I think that it has a lot of merit in itself. But I know that we're crunched for time here. We're already at 7:25, so I'm going to take the opportunity to turn this over to Inspector Meeks and let her talk about the impact program.
Thank you, Chief. Hi, everybody. I'm just going to briefly talk about some of the things that we've done in Belleville and that we're moving forward on in order to better support individuals and to work collaboratively with all of the community partners. A lot of them are here today. So situation table, which I know is probably active in other communities, that's been going on for the past 7 years, which we felt a need. We based it on community mobilization and the way the province was trying to address some of the issues that were going on. So the situation tables that exist right now are when we have acutely elevated risk individuals in our community that are identified either through the police or through another community agency that sits at that table. So we have an officer that's assigned to that liaison officer, and that's helped to address a lot of issues, whether it be mental health, addictions, or housing. So that's been a very collaborative partnership. It's been very successful on dealing with some of our more, like Inspector Semple said, in relation to the repeat calls for service that we deal with. Back in 2017, we came up with a memorandum of agreement with our local, with Quinte Healthcare Corporation, because we wanted to, one of the main things was to decrease our wait times and be more efficient in dealing with our response and our attendance at the hospital when we did apprehend someone. In relation to that, then we developed the Health IM, which I know Carla's talked about. We instituted that in 2019 through the Assistance of Addictions and Mental Health in a partnership, and the funding was received through that instead of through the police budget. As a result of that, the data and analytics that we've retrieved from that, basically what that is a risk assessment tool. So when our officers are on a call and they're responding to a call that has a mental health component to it, they're able to go through this risk assessment and determine how can I best serve this individual that I'm dealing with, whether or not we apprehend, or whether under Section 17 of the Mental Health Act, or whether we find a better community support for that individual. Like the chief alluded to, the statistics right off the bat when I presented in July 2020 to the Police Services Board showed the results of that, because we wanted to do the same thing. We wanted to be more efficient at responding to those calls and not bringing people to the hospital and burdening the ERs. So as a result, we saw a 50% decrease in our apprehensions in relation to, we were more informed, and we were more informed through that risk assessment. Another surprising thing is that we also wanted to collaborate. One of the goals of the program was to collaborate more with the community agencies out there. And as a result, we did a 100% increase in our referrals to addictions and mental health, but also the situation table. So we had two avenues that an officer right on the road could make those referrals and make them happen so that there was a follow-up. The second thing is that we had the wait times at the hospital, which obviously, like Inspector Semple talked about and Detective Sergeant Carlos Stacey talked about, is that wait time where we need to free up officers sometimes because there's 4 and 5 hour waits at the hospital. As a result of the implementation of the Health IM Act, we decreased that by 46%. And I just met with all the platoons just to do a follow-up of that to find out if they're still experiencing that decrease, and they are. They're very happy with the results of that, because that better serves the client. They're not there waiting as well, and also we are able to get out of the hospital and respond to other calls for service. So as a result of the Health IM, the data that we've been collecting on that in relation to apprehensions and referrals and all those other things, we collaboratively started to meet, the OPP in Hastings and Prince Edward and myself started to meet with staff with Gary Laws and his group at Addictions and Mental Health in regards to how can we work together, and we've explored all these models that are around the province, what would work best for the city of Belleville. So as a result of that, and I don't know if Gary wants me to talk about that or Gary wants to talk about that, but we received, as we did the announcement not too long ago, a few weeks ago, is that the Impact Program, which is what ours is going to be called, Hastings and Prince Edward, it's based on the Waterloo Regional Police Service and Wellington OPP model. And that's basically an integrated mobile police and co-response team. It's very much like what Inspector Semple talked about, in the sense that the worker will have 2 workers assigned to Belleville Police. OPP detachments in the rest of Hastings County will have different, and it's all based on calls for service, time of day, amount of calls, and what we need in each area. So I'm speaking to Belleville, obviously, because I worked for Belleville Police, but the goal of that is you're going to have one embedded worker who works out of the police services, including our own, and they respond 10 hours a day, 7 days a week. We go to the call, and when there's no safety or concerns, or we've mitigated that, we will call in that worker to better handle that call. And that includes maybe going to the hospital with us, or us leaving that mental health worker in order to assist that individual. And that will be not just for mental health, but that would be addictions issues as well with this model. The other thing is that we will have a transitional worker assigned to each detachment, and obviously the Belleville Police Service. And that transitional worker that's assigned as well would assist on all the follow-up and all of the support that that individual may require after a call for service with us. So that's that link that communication, that collaboration, that link that we need, and that follow-up that was one of the goals of this program. So we haven't started it yet. We received the in-year funding through the Ministry of Health. And so in terms of logistics, we meet we are meeting weekly and bi-weekly in order to develop protocols with each other and determine how this best can roll out this year in 2021.
Okay, thanks very much, Inspector Meeks and Chief Callahan. Yes, the Impact program actually was announced between the time we asked for this discussion, and I can tell you I was quite happy to hear that, because it was a missing piece, I think, when we were coming into this discussion. So I'm just very glad to hear it. So we're going to move into some of our addictions and mental health folks right now, and just hear their experiences right now and some of their successes and some of their interactions with police. And I'm going to ask Sandy Sidsworth from the Enrichment Center for Mental Health. Sandy's the Executive Director of the Enrichment Center for Mental Health here in Belleville.
Thank you. We aren't doing anything grand or earth-shaking. We have worked always and try to approach it as a partnership. If we need to have police attend on our properties where our transitional housing is, or here at the office, and that's worked really well. Just I have been in the field for a long time, and in the domestic violence, child welfare, and now in the mental health addiction sector, and have worked frontline in that capacity, worked with a multitude of officers. Some experiences haven't always been positive, but what I have seen in the last 4 or 5 years is a real shift in the officers that we're working with and trying to understand the individuals that need our support. And I noticed Dr. Moss asked a question in the chat, and that maybe this will give some light to that. Assistant Deputy Inspector Meeks approached me just before the first lockdown about if young officers, new officers, could come and work alongside staff in a volunteer capacity. And when lockdown happened, that became instrumental to making sure the small essential worker team didn't burn out. There was 6 of us trying to provide meals to food security through Eastminster Church. or Bridge Street United. Oh my goodness, I'll get in trouble. And then we were working with the transitional housing and community members that were fragile. So we had some amazing officers, young officers come out, and they worked alongside of us, didn't ask any questions, took orders from my team really, really well. And what I was so impressed with the caliber of officer was wanting to know the clients beyond them wearing the uniform. And that is so important, to understand that there's a humanity behind a label, or when they're called to a crisis, and some of that de-escalation that could happen when somebody was able to see that. And just some really wonderful little wins. It's not impact, it's not some of these other programs that you're talking about, but it's a true partnership, and it creates that ability to work with our clients in a different way from that policing lens. Now, I will say they do attend twice a month with coffee and donuts. I didn't know if I should share that, seeing it was policing, but coffee and donuts. And especially our triage home, which is men that are just coming in off the streets. You would think that they would, and I'm going to state it right here. You can put an officer in plain clothes, but they still look like an officer. So all of our folks, there is no surprises. We're not trying to bring a police officer in to narc on them or anything like that. The rules are, they know that this is their home and treat it accordingly. But the clients look forward to having the officers arrive and ask us, is it this night? Is it this night? And that's evolved to having some of the officers facilitate some of our support groups, especially around our men's groups, that just men are really trying to find some support. And it's kind of this little organic thing that just kind of has taken off. And what we are hoping is that it really does give that sense of who someone is, in that vulnerability, that they're not this person that was causing a disturbance, that they're Joe who lost his job, was up north and has come home, but you know what, maybe addictions was an issue in the past, and he's tried to find some way to feel better about what's going on in his life. I'm being very low level and we're very quick in terms of time, but the other piece that's come out of this is that I know Inspector Meeks, I have been working with families around the province impacted by an officer's suicide. I don't know how that kind of evolved. I suspect, though Sherry's never told me directly, I suspect that she is directly responsible for some of those referrals that have come into our office because of need. And we're very pleased to help those families and support them through this horrific time. And as always, we focus on recovery. We don't get Ministry of Health money. That's no problem. We've found our own way to make a community mental health agency function through recovery, resiliency, and renewal and employment, transitional housing, support groups, peer work. But the biggest thing is about approaching policing as an opportunity for partnership and to learn how to de-escalate beyond the uniform. And we've had, it's gone beyond Belleville Police Services. We have a young officer coming down from Toronto twice a month. So it's a little idea. I don't know where it's going to go. No money, that's always a benefit this time around. But if you want to give us some, we'd be happy to take it. But okay, that's us.
Yep. All right. Well, and I think anybody listening probably knows why Councillor Thompson and myself spent several years on the board of that amazing agency when it was Canadian Mental Health Association. Sand Eater people do a lot of great work. Thank you. Moving on to Mr. Laws, Gary Laws, Addiction and Mental Health Services, Hastings, Prince Edward.
Good evening, everyone. Pleasure to be here. Pleasure to represent Addiction and Mental Health services here in HPE. So much has already been said. Thank you very much, Sherry, for your detail around the impact program. So we've actually spent, quite frankly, decades working with the Belleville Police. Similar to Sandy, we have some really great stories like showing up at residents if there's an altercation, ensuring that they'll come out and check on people because they know that they're living in our housing program. So we provide housing, we provide addiction services, opioid management programs, rent subsidy to clients. We have our addictions treatment facility in Belleville on Foster Ave, quite a plethora of services. But we have been working for years trying to lift off the ground the impact program that has been discussed. Very similar to what KFLNA is doing, and we have the OPP and BPS involved in getting this program ready to launch. There was quite a large announcement of in-year funding this year, and so it is our hope that we will hear of a funding announcement for ongoing program. It's actually quite a large and in-depth program. It's about 15 staff that will be connected to impact, including the on the ground in the detachments, as well as the transitional case managers, because we want to ensure that the clients do in fact get that service and get the right resources to the right at the right time. So I really don't want to be too repetitive on what has been said, but appreciate on behalf of the clients within HPE, really appreciate the opportunity to be heard and to recognize our fine police partners and our other partners within who are also we work with Susan Sweetman and the Children's Mental Health Agency. Our Youth Hub is a contracted agency, and we work very closely with them. I don't think it's any secret, because of we're having this forum, that mental health and addictions is a significant issue in HPE. Significant. We have a lot of work ahead of us to do. We need to look at how we can provide those supports and services to people that want it. We are a clinical agency, so we look at treatment and recovery and that treatment and recovery model. But we do engage in working with our other partners who are kind of the boots on the ground out there. We provide 24/7 here in Belleville, a small group of folks here at the Home for Good, so we're connected to the county. Happy to work with the county on the issues that are associated with whether it's housing or the downtown initiative that we've been talking about recently. So lots to do, lots to concentrate on, but not one group will ever do it on their own. It's too vast of an issue. You'll hear from the hospital that calls, the patients that come in. There's clients that are living in hospital, LT, long-term care facilities that are inappropriately housed. They don't have housing, and besides having primary diagnosis of mental health and or addictions, they also have other comorbidities of health-related issues. So we actually have a massive proposal out on that as well. So we are looking at how we can serve the community as best we can, but we must do it collectively. We must do it as all collaboratively, and where we can shoulder responsibility and provide programs like Impact, then we're there, we're ready to do it. So cross your fingers, everyone, for that we can get this funding taken into the new fiscal year.
Thank you. Thank you very much, Gary. That was, and again, I think it underscores the fact that we, with this group that's here tonight, we have city council, but we have all these amazing agencies and police services and that's what it's going to take, a collaborative effort. So thanks once again. We're moving to Susan Sweetman from the Children's Mental Health, Hastings and Prince Edward. Susan, can you just share a little bit of
Sure.
what you folks are doing and what you would hope to do going forward? Thank you.
Sure. Thank you. Good evening, everybody. Again, much like Gary and Addictions and Mental Health Services, we are the arm of that delivers treatment services to children and youth 0 and up to the age of 18 for both addiction and mental health. And we also have services available 24/7 in the sense that we have a crisis line that is open, serving 24/7. And we as well serve the same geographic area that expands for Gary as well, in the sense of it having offices in Bancroft, Madoc, Belleville, Trenton, and Picton, and a residential treatment home that we have here for youth, generally from the age of 12 to 17, that are struggling with suicidal ideation and other psychiatric issues. And that service provides a step up, step down from the Hotel Dieu Adolescent Psychiatric Unit as well. And we are across the province, there's 33 lead agencies, service areas, that we are the lead agency for Hastings, Prince Edward, and Northumberland. So we oversee a number of programs that span across those different jurisdictions. And I think, as Sherry had mentioned earlier, we support that work at not only the situation table, but we also work with intersections and numerous other situation tables across that geographic area. The other thing is that I really want to ensure that our police force understand is that although we have a large population here of adults that are struggling with addiction and mental health, we actually have a large population of youth that are the youth that are struggling before they get to be adults. And certainly the role that we can help and support is that when families put calls in to the police where there is concern around the behaviors or situation with their young adults at home or in their families, is that we can be a support. And as I said, we have a 24/7 crisis service, so that it's as quick as a call to assist, because a lot of our crisis calls after hours often are around helping parents de-escalate situations where there are youth in the home. We, through that process, quite often those calls are safety planning and de-escalating and making sure that we support children and youth in coming back from suicidal ideation and different things in the home until we can see them in person. We do safety planning and such with them. So there's lots of those pieces that we could probably be used more for. We recently added Officer Jill McCulley to our board of directors, she's been a wonderful addition to our board. Thank you, Sherry, for referring her over to us. And one of the things that she talked about is the potential of us creating a business card, a different business card that would be shared with all the police officers, that would provide them the information and our phone numbers, so that if they are out on a call and it is related to a youth in the crisis situation or within a family, that they knew that they would know to call us, and that we could assist them on the spot in that situation. And there's been plenty of referrals that we get from all the community partners. And what we're trying to do is really change the trajectory of youth in our community so that we have fewer youth that end up, you know, if we can, changing that trajectory for adult mental health. If we can get youth the tools and the skills and the assistance earlier on, that we hope that we can prevent that later on down the road. But again, as Gary said, we work in tandem both with the adult system, but also with their school boards and with CAS, with Quinte Healthcare, with the emergency departments. We also work with a lot of primary health care providers across the region. And we're all part of the OHT, the Ontario Health Team, that's being stood up in this area as well. So, you know, we just want to be more assistance and for people to know that we're there in situations where there's help needed for children and youth in family situations.
All right, Susan, thank you very much, and I'm quite happy that you had your input because, yeah, I think it's an important piece, the early intervention and that collaborative piece with the with police as well. So that's great. What I'm going to do at this point is open the floor to members of council who are taking part, as this part of the meeting is a special council meeting. Anyone have any questions for any one of our panelists? I see Councillor Kelly. I'll go to Councillor Kelly first, and then Councillor Alsop.
Thank you, through you, Mr. Chair. Thanks to everyone for coming tonight. Lots of good information. This is a question I'll just direct it to the police. Someone can pick it up and answer. I was listening to the Kingston Detective Sergeant saying, I believe the number was 7. Actually, they've had special training with mental health. And we heard from Belleville and the OPP how they go about doing things. My question would be, at the police academy with new recruits, if this is the new model for policing and partnership in mental health, is that now new as far as the training to become a police officer, that eventually special training seminars or 40 hours of training on mental health, will that eventually just fade away because all officers will have the training when they go to the academy?
So I can answer that, Councillor Kelly. We've been trying to work with the Ontario Police College to ensure that we have additional training for the recruits, the basic recruit training. And sadly, the amount of time spent on de-escalation training is not where it needs to be. There's a lot of talk right now in the basic recruit program of potentially extending that training. And I'll give the example of the OPP do a great job that when they bring their recruits back from the Ontario Police College, and correct me if I'm wrong, Scott, but is it 8 weeks or longer that they spend in at headquarters?
No, they spend 2 weeks with us going in, and then an additional 8 weeks when they finish.
Yeah, so that in itself is very significant. Now, I'll speak about the Belleville Police Service. When the recruits come back, they spend additional time with our training officer and a whole different multitude of training facets, but one of them is in the de-escalation techniques and running additional scenarios as well. So it's something that we really focus on, but it's something I would agree with you, Councillor Kelly, that there needs to be more attention paid at the ministry level to ensure that we're having that training from the onset, and it's a critical component of that basic recruit training.
Okay.
I would just, I could top up just, I know, I'm sure Kingston, Carla would, and Robin might point out that we also have lead training, which we deliver to officers once they're on the job through, I know KFL&A, and I'm not sure if Belleville does the same. I'm seeing shaking heads, so I'm assuming they do, which is a week-long training for officers, and it kind of points to the question from Dr. Moss about understanding biases and understanding, having compassion through understanding of mental illness and how it impacts people. That's the focus of that program, is to get a lot of feedback from our mental health partners on, you know, what officers can expect, not just officers. We actually attend that training with EMS and healthcare to work collaboratively together to understand how people present themselves, to try to get a better understanding how to de-escalate better and to handle it better. So that's just some additional training that we get to our people.
I'll just answer there quickly. I had my annual training today, and just today we spent most of the day talking about de-escalation techniques and practicing those. So it is part of our regular training.
Okay, thank you. Yes, we do have a chat question. Sorry, I will get to you, Councillor Alsop. Somebody entered into the chat, Dr. Andrew Moss, and some of his question has been addressed earlier about the training beyond the de-escalation and support of frontline officers. But also included in his chat question was how do police officers' own mental health is addressed in their work, given their often strong reluctance to seek their own support. This is, I think, is important. We want healthy officers having healthy interactions with the people in our community, and if they're not healthy themselves, that's a problem in itself. Would anybody care to address that?
I'll just speak to that just quickly. We have in Kingston established a bigger, sorry, I apologize, my dogs are going crazy there now. Someone's at the door. But we have our peer support group. I apologize, just give me 1 second there.
Last night it was Councillor Williams' kids, and tonight it's the dogs.
My dogs.
Welcome to the joys
Sorry.
of Zoom. Yeah.
Exactly. Yeah. So, like I had said, we have a peer support group here in Kingston, and we recently added quite a few officers to that peer support group. And some of the things that we're looking at is implementing a regular program with the officers through peer support, including the use of an application program for our peer support, so that the officers have access all the time through this application to services, to resources, to information books, as well as the peer support officers themselves directly, so that it's always available. So we're always looking to make sure that we're taking care of ourselves as much as we can, but we're definitely focusing more on that now than say we were 10 years ago.
I can
Go
just
ahead.
add one thing.
Go ahead.
So when we were designing our new building and making sure that we had the best interests of the mental well-being of our officers in mind, we actually have a small room for officers to come back to and decompress after they've been involved in a very, very serious incident. So we would have somebody from the peer support team working with them, talking them through it. And or we also have a chaplain program that we would provide to the officers, the EAP program. And another thing that we do with the peer counseling program is that not only during the night of the incident, but a couple days later, we'll have somebody follow up with them just to ensure that they're doing well. Because I can tell you, there's millions and millions of dollars being spent across the world looking for what the ticket for resiliency is for the officers. And right now it's an intangible. We don't know exactly what that looks like. So while we do have screening and mental health support for our members, and some of our members who are in very high stress or very vulnerable sections within the police service, that's a program that we would like to someday expand to everybody, but obviously there's a cost associated to it. And you have to look at the weight of the cost versus the benefit to the officers. And we believe the benefit to the officers definitely outweighs the cost. Thank you.
And if I may add, it's Gary from HPE. Part of the proposal that and the program that we were working with the police on is that because I saw the second in the chat about police officers not necessarily trusting or or whatever. That is one of the strong elements in this, that we will have our staff in the detachments, and they will be working alongside as if they were part of that they are part of that team. And so it'll be an ongoing to enable the police officers and our staff to understand what the police officers have to deal with on a call and on a day-to-day basis. And so it is a way of supporting one another. We have talked about and planned for some training, but right now we're just still trying to launch the program. But I just wanted to address that second chat that was just in the chat room.
Okay, thank you. And just in the interest of time, I think we have Councillor Alsop had a quick question, and then we're going to have to wrap up this portion of the meeting and move on into the public section, because we do have a lengthy list of members of the public wishing to make their points. And go ahead, Councillor Alsop, and I'll wrap up this hour once we're done.
Yes, thank you, Chair. I really appreciate it. And my question largely related to mental health among police officers. So I'm really glad that we were able to address, as that was a question that came up in the chat as well. So I think I'll just use my time very briefly, as I know I want to save an hour for the public, to amplify what Susan Sweetman said. I thought it was really important the way that you talked about addressing the adult mental health crisis by working with people when they're younger, trying to address it early. I'm certainly someone who struggled with depression at a young age. I did not expect that I would ever be this old, and I certainly did not expect that if I was having this conversation with members of the police force and members of mental health, that it would be from this position as both a counselor and a member of the board of directors at the Enrichment Center for Mental Health. So thank you all for what you're doing. It's a very important discussion. I'm really glad that we're having it today.
Thank you. Now, I'm ending this portion of the meeting. I'm going to any of the panelists who took part from our outside agencies, you're not by any means required to stick around, because there won't be any opportunity, again, owing to our restrictions on time, for members of the public to interact with you. It's just the way we've had to divide the meeting. So thank you very much for all of you who took part. And we will, once we clear the panelists from and thank them for taking part, we will move on to a list of public participants who have registered to take part. So thanks again, folks. Thank you.
Thank you.
All right. Thanks again. Thanks all. All right. So we're left with council and members of the public. Thank you very much. And I have our able assistants here in the room with me, helping me out. One person who was going to be in on the last portion, who had asked to speak on the last portion, and unfortunately, again, owing to time constraints, I've asked that she be held and kept in queue first in line with members of the public. But Janet Kinsey, who is the mental health manager at Belleville General Hospital. Janet, if you've got your link and you can, we can log you in, and I'd like to hear what you had to say, especially after listening to that first enlightening hour, the first hours, and hearing what we did. Janet, are you there? Ah, okay.
Am I there?
There you are.
Hi.
Hi, Janet. Yes, sorry, I put you, because you were last on the other list, you're first on this list. So go right
That's
ahead,
all right
Janet.
with me. Thank you
All right.
for letting me
Thank
be
you.
here. Thanks for doing this. It's so,
Yep.
it's an important conversation. Yeah, I manage mental health programs at the hospital. So we have had our hand in a little bit of everything that has been spoken about today, and are happy to do that. We have our own, we're busy with a lot at the hospital, as you can imagine. Mental health calls and requests for service are increasing for us too. I manage the Crisis Intervention Center. We've seen a big increase in requests for support. And so we have been providing that. We also have a 24-hour crisis line that is staffed by our crisis staff and we see people now virtually. We're seeing probably about 200 appointments a month. We see about 100 people in ER a month. We take about 800 phone calls a month. And that's a pretty significant, that's an average, but that's a pretty significant increase over the past, I would say, 6 months. So we are managing to keep up with that, mostly virtually right now, and happy to keep working to offset some of that and provide services that fill in the gaps. Addictions and Mental Health Service has been really creative and worked really hard to recognize what's lacking and connect people who can help, because it is definitely a concerted effort on the part of everyone in society. It isn't a system problem. It isn't a healthcare system problem. It isn't even a mental health problem. It is a societal issue that we need to approach from all kind of angles, and everyone pitching in makes a bigger difference.
All right, thanks very much, Jen. And again, I apologize. We are limited by time, so I'm going to move right along. Thanks very much for taking part. Yes, thank you. I'm going to go now to Michelle Ogden, Mr. Coyle. She's Manager of Housing Services for Hastings County. Michelle. Oh, she sent regrets? Well, that makes our life easier, unfortunately, but I do miss Michelle. Let's go to Martin Vanderland then, Executive Director of New Life Women's Home. Welcome, Martin. Go ahead. Did you have some comments for the forum?
Hello, everybody.
Welcome.
Can you hear me? Good.
Yes,
yeah.
yes.
Yeah, thank you. I wasn't actually anticipating saying too much, but I guess what I'll say is I appreciate what I've seen and heard here tonight, the different organizations getting together. We just came back from 3 years of working at a drug and alcohol facility, in residence facility on the East Coast, and with a vision to come back here and start one. So we're probably, at least a year off from opening our doors, but we too hope that we can, be part of the solution as we go forward. So yeah, we look forward to getting to know some of the members here and playing our part in it as well. So thank you.
Martin, great to have you. Hey, let's going down the list, Dr. Andrew Moss, Moss Psychology. Dr. Moss, are you there?
Hello, you can hear me okay?
Yes, welcome,
Oh,
Dr. Moss.
Yeah, thank you very much. Thanks for letting me join. Yeah, I mean, I've been working in the Quinte region for over 10 years now, working alongside the police in their own sort of mental health, supporting them as well as the community and their interaction with the police. So I kind of see both angles really and see how complex the issue is. I guess what comes up for me generally is this sense of how are people being supported on both sides? So for instance, like I mentioned in the chat, the police, are they getting the relevant training that really makes an impact in their day-to-day life on the ground? Having spoken to police officers at various levels, they say there is quite a bit of training out there, but some of it is quite disjointed and quite disconnected from real life scenarios. E-learning, for instance, is a great thing and it develops a lot of competencies, but often what we're dealing with is the need for experiential practice in dealing with people's mental health. And the experience I get from officers is that some of the training just does not match and does not equip them with a great sense of confidence, maybe. And a lot of what the theme is that's coming up is around maturity of police officers, which is great if you've been in for a few years. But if you're a rookie officer and you're new and you're kind of out there on your own, what's the level of support you can pull from? So you know, a lot of the issues were around, you know, who's there to turn to, and kind of being that kind of culture where often it's very difficult to talk and reflect any difficulties you've had with a call. I get the sense, you know, are they really going to share? Are they really going to share each other's expertise and really, because there's so much, you know, peer support that could be really developed, and I'm not sure it's really getting addressed right now. I think there's work to be done. The roundtable discussions, the debriefs, how that's done in a safe and effective way. And even just using professionals like myself in understanding how we develop psychological safety, how we develop people's ability to really share in a very vulnerable way. Because often police officers have to put the front on, they have to put their professional front on, but when they go home, what are they dealing with? It all comes crashing back, and then they go back on and they might be dealing with a mental health crisis with somebody, and where's their ability to be empathic? They need to recharge their batteries, they need to be safe internally in order to be safe with other people. So that's why I kind of get both sides. Sometimes, you know, people say, you know, having a raw deal with police officers, but I can see that the police officer side is I'm not getting the support that I need in order to do my job in a psychologically safe way. So, I mean, it's a hugely complex issue, and one that I think we're going to wrestle with for a long time. But I mean, one of the issues around this has got to be multi-agency. This has got to be about sharing knowledge and sharing expertise in lots of different ways, finding who your stakeholders are, and making sure that we pull from the different expertise to gain a really coherent picture of how to support our communities and how to support our officers as well.
Okay, thank you, Doctor. And that, you know, it's an important point that I think a lot of people miss. And I think I mentioned it in the last hour that, you know, unless our officers are healthy themselves, you know, they're at a detriment to helping those who most rely on them. So thanks very much.
Thank you.
Insightful. Thank you. Sorry. Okay, can you hear me now? Okay. I'm going to go to Paul Bell. Mr. Bell, I believe he's not affiliated with any organization, but Mr. Bell had asked to register. Thanks again, Dr. Moss. So I'm sorry, we've got Mary Jo Courier. Hello, Mary Jo, how are you?
I'm good. I'm actually surprised to be online. So,
well, we're glad you're appropriately attired. Yeah. Thanks, Mary Jo. Sorry, yeah, we do have a list, and those who are welcome to join Zoom are welcome to join. Otherwise, they can mute their video. So. Did you have anything? And I think when you registered, you mentioned that there are some observations from some of the people downtown. So go ahead.
Yeah, I think I registered just to share some of the things that are in the works with mental health and addictions, and Gary did allude to that. So I don't know whether this is something that I need to share here, or whether you can just move on to another person.
That's fine. And Mary Jo, you're always welcome to speak, and I know that you're you're most comfortable doing so. But if this is a topic that you'd prefer to do offline, we'll move on, because we do have a good number of people that wish to take part.
Yep.
Mr. Coyle, thank you very much, Mary Jo. All right, Mr. Bell next, Paul Bell.
Unmute. Hello.
Hello, Mr. Bell. Yes, go ahead.
Hi. Thank you. Sorry, this is my first Zoom experience, so you guys could really have had your way with me by just pretending you can't hear me. I'd like to read a statement. I've been following this, the evolution of this public forum for the past, I imagine, about a year. In a manner, we're discussing a crisis that does not exist. Now, I'll share my story to defend the reputation of Belleville Police and to demand that council assure the public that they will order no further discussions advancing the possibility of disbanding Belleville Police Services. Ontario municipal councils have no authority over police budgets beyond accepting or rejecting them, despite what this forum infers. Presenting this forum as a tool to discuss, in part, police funding concepts and ideas engages the disband option. Categorically, that's what's on the table. When Councillor Millett appealed to council last July to host this forum, he invoked Selma, Alabama of the 1960s in his rhetoric. That implies a systemic local crisis requiring immediate public intervention. Now, I've seen Belleville Police respond to wellness checks and distress calls. What I witnessed recommends citation, not denouncement, from City Hall. Everybody interested in this forum is likely familiar with the term wellness check, but possibly because of a few horrific outcomes in various jurisdictions that have been reported in national media. It's a current concern that is receiving appropriate attention from the experts who inform Belleville Police policymakers. The Belleville Police responses I witnessed were not brutal or unprofessional. The confident application of excellent training and good judgment was what I saw. I see no reason to question Belleville Police or those directing the service under any pretense or presumption that they're systemically underperforming. Comparison to 1960s Selma is hyperbolic and denigrating. I did witness one systemic flaw in the relationship between policing and mental health services. After police correctly identified a person in mental health crisis, took them safely into custody, and brought them to the hospital refused to admit the person under the Mental Health Act because alcohol was present. Police returned the person to their home only to return the next day after a family doctor became involved and a judge signed an order enforcing the act, imposing treatment. Belleville Police performed perfectly. If residents claim incidents of injustice, those incidents should be investigated. Affording untested allegations, the weight of a public hearing implies that normal channels have failed. That's unfair to police and undermines the public's confidence in our institutions. Some Ontario municipal councils have disbanded local police and hired OPP in recent years. The move is always precipitated by forums like this. Mental wellness and harm reduction infrastructure funding is discussed and later promised from overprojected savings from disbandment. The process is stressful on the public. Talk of changes in policing always causes anxiety. The Belleville Police Services didn't request this public forum. Belleville City Council ordered it on the demands of an activist group. Police and mental health issues warrant public discussion and work and study by experts, but they're not a Belleville crisis. Public dialogue on policing and mental health is of itself an undeniably good thing. When that dialogue is initiated by a vote of an Ontario Municipal Council and references police funding, it veers into a divisive contractual realm. Should council decide to implement any initiatives or priorities presented at this forum, they have no authority to direct Belleville Police Services to comply. Thank you for allowing that on the record.
All right, thank you, Mr. Bell. Thanks for your observations. We can discuss some of them later at a different venue, but go ahead. Councillor Alsop, did you have a comment? Or
Just a quick question. I'm noticing that some people in the YouTube chat are asking if the professionals are still available, if they have a direct question for them. Just they're not able to see them as participants anymore, so they're wondering if they are still available.
Oh, some of the participants in the first hour?
Yes.
Yes, and I noticed that there was a chat question at this point. Can someone please address why the chief of police left for the community discussion? Well, all of the panelists were given the option to leave, whether or not they and it was partly an operational matter, so that we can hear actually from, I've got a list here of some 20 some people who have registered to make comments. So if we were ever going to get through them, I think if we broke it down into one-on-ones, and then sometimes we got into side discussions with individual participants, it was purely the structure of this, I guess, is the best explanation. And we had hoped to hold this in a town hall session where I think we could have gone for as long as people could bear to sit in a seat. But this is cumbersome. It's not the way ideally to hold a town hall meeting. So it's not a great excuse, but it's the only one we have, unfortunately.
Oh yeah, and I only asked because I saw it, but
I appreciate that, and yeah. So that's the reason for that. I know some people may not like it, but in an effort to hear all these voices that we have on the list, that's the only way.
The chief of police is still here. He's just not on screen. So
that's fine.
Everyone should know that he is there as one of the attendees.
He's listening along. Okay, thank you. All right, if we can, Mr. Coyle, can we reach out to Perry Simard, Registered Nurses Association of Ontario? Joining now, thank you. There you are. Hello, Perry. How are you?
I'm doing great. Thank you very much. I appreciate being allowed to come and join this meeting. It's a very important topic in this area, and not only just this area, but I think throughout Canada. Some of the concerns that I want to bring forward is with COVID, there's a lot of expectation that mental health is going to become even more of a problem to address. And we can hear that in a lot of different reports that are coming forward. One thing that I was interested in seeing, and a little bit of preparation in coming into this meeting, is I was looking for any statistics that might be presented in the police reports from the OPP in the area or from the Belleville Police on mental health calls. And I'm not seeing any reporting, but however, in this meeting, it was kind of interesting to see that the Kingston Police Service indicated that they had to change the way that they ended up reporting in order to track information. And I think that's really important, is that something like this is being formed in a sense that you're not just taking money and putting it on a problem, because that's not going to solve the problem. You're going to have to identify very strong measures to move forward on. And right now, without the statistics or without the data, that I'm not sure if it's not present to the public, but I can't find it. I'm not sure how much of a problem it is, and what sort of measures you want to move in making progress. The other thing that I want to talk about is that, right now, nurses in Ontario are extremely stressed, extremely worked incredible. And, trying to get nurses, you can see that there's job postings every day looking for nurses. So I'm kind of wondering, where would you end up getting these nurses, if you're going to hire nurses, or if you're going to hire social workers, or where are you going to get your mental health workers to work with the police? And then how do they fit into the organizational chart? Are they reporting to the mental health section? Are they reporting to the police services? Where are they fitting in the program? I just want to give a little bit of insight on my own personal experiences, having worked as a nurse in this area for over 18 years. I've worked in a number of different areas, from community health to working within the hospital system, working palliative care, long-term care within the college. But I can tell you that, I've worked with the police in Belleville, and they're wonderful to work with. I just think that sometimes when they talk about the wait times under the memorandum of understanding with the hospital, that when they talk about the wait time and that they're making really good progress on the wait time, they are. They're making good progress on the wait time of the officer being released. They're not talking about the patient, okay? From my own personal experience, that patient is brought in to the hospital system and they're released, but then, that patient actually sits within the hospital, most of the times in the emergency department. A lot of times it could be argued that that patient isn't sitting in a well-structured or well-suited area. I mean, the staff there do an amazing job at trying to accommodate this type of a patient. But that patient at times can end up being there for many, many, many hours until they're seen by the appropriate physician. And, I'll tell you, if you have a patient in one of the other hospitals other than Belleville, then that patient is getting access to care a lot later than the patient in Belleville. A lot of times the patients are only getting access through a telephone call or a video conference. They're not actually having any face-to-face, or any face-to-face assessment sort of thing. It's very strenuous, I can tell you. Not only for the staff or the system, but also on the patient themselves. So the other thing I just wanted to mention too is that, I'm really happy to see a lot of people talking about collaboration. One of the things in this whole mix of a problem is that if we're going to try and support this population, we really have to break down barriers. And that's one thing I haven't heard either, is how is this initiative going to break down the barriers? What are the barriers? And so one of the things that I can see as a barrier, having worked in the system, is that I think we can all see that and admit that there's a lot of gaps. It's not very seamless. And I'm just wondering if this, this would be an opportunity to use this position to try and bridge those gaps and, make it a little bit easier for the patient to be able to, or the client to be able to work through the system. Great initiative, definitely needed, and everybody's saying the right thing, but I'm not hearing a lot of empirical information. That's all I really have to share. Okay. Thank you.
Well, I think Perry, some of them, especially the officers and some of the people in the first hour, I think if we let them roll, they cross your eyes with some statistics. But yeah, we're trying to get a good feel. And again, with the unwieldy platform that we're using, we're just trying to hear from as many people as we can. So, Perry, thanks again so much, and we'll call upon Jennifer Corelli now. Jennifer Corelli from UTAB. Okay. All right. She had registered. Let's go to then. Is Brad Beal there among attendees? Brad Beal. No? Brad Beal's not there. Okay, so yeah, well, we can go to Brittany Hope. Is Brittany Hope there? And that is BPSN. Yeah, I think it's Brittany Hope, number 13 on the list. Okay, yep, go to her.
Can you hear me?
Yes, is this Brittany?
Yes, thank you. I was booted and now I'm back.
Okay.
Thank you, everyone. I'm representing Belleville Peaceful Streets Network. You know, we're a group of concerned citizens who advocate for safety and accountability and transparency from our government systems. And we're trying to make politics and policing systems more accessible to Belleville residents. We've collected a number of anonymous statements from the community that we'll share here, and we hope this feedback helps you in your work toward bettering our community. Thank you to Council for creating an opportunity for folks to share their experiences. Although we are disappointed to not have an opportunity to speak to our police service directly in this case, as that's what we were expecting. So Mayor Panchak has said that Chief Callahan is still here. Are we able to direct a question his way, and is he able to come back online and answer it?
That would be up to Chief Callahan. It wasn't in the format, so if Chief Callahan wanted to, I don't know.
Well, why don't I start with one of our first statements, and if he wants to come back online, he can, and I'll go back to that question. My first statement that we had collected is as follows. We talked about how police are addressing mental health in our city, but I want to address the impact Belleville Police has had on my mental health this year. This is not meant to be an attack. This is feedback taken from my experiences. I was raised to believe that our police are here to help us, to protect our community, and that they're only dangerous to the bad guys. So when news media publishes that BPS officers are being investigated for bodily harm charges by the SIU, or my community protests racist behavior of an officer, and the BPS fails to provide us with details on the outcomes of these investigations, I don't know who or what to trust, because to me, that is not serving the community. That uncertainty then makes me feel insecure, anxious, and afraid for my safety, because the above experiences make me think that BPS does not consider itself accountable to me. I think it's important for us to acknowledge, in order for Belleville Police to better serve those with mental health in our community, they must also understand the role they play as an organization in influencing how safe or unsafe Belleville residents feel in their own community. And how can we as a community have faith that BPS is working to serve us when there is so little transparency or communication regarding officer misconduct? My second statement that I had collected, if you'll be patient, this is feedback from a member of the community who wants to stress the need for greater training when it comes to women who have experienced intimate partner violence and the impact that trauma has on their mental health and the ensuing investigations. When police do not have enough training on mental health and trauma responses, the behavior of survivors when reporting or while in abusive dynamics can lead officers to certain, not illogical conclusions. For instance, a woman who speaks in a detached, deadpan manner, or perhaps laughs while detailing a violent event, may understandably alter an officer's perception of the seriousness of the event if they do not understand that these are trauma responses. Alternatively, a complainant who is hysterical, crying, and shouting may be interpreted as unstable or aggressive rather than as someone who is having a trauma response. These factors, when misinterpreted, frequently lead officers to incorrectly assess the complainant's credibility, and this impacts an investigation. The remedy to this is additional mental health and trauma training, or having mental health or trauma experts help interview complainants. So I see Officer Callahan has chosen not to join us. The question that I had was about the kind of training that officers receive in terms of harm reduction and what kinds of training they have coming down the pipeline for dealing with mental health later this year. I don't suppose anyone in company is able to answer that question.
We have two members of the Police Services Board. So if either Councillor McCaw or Mayor Panchak wish to, but I think Brittany, we heard Inspector Meeks talk about the program that's rolling out in the first hour, and I don't know if that answered some of that question, but again, if anyone wants to chime in on that. I don't know if we have an answer for it right now, or if somebody can get one too. Yes, go ahead, Councillor McCaw.
Thank you, through you, Councillor Millett. I just to say that I don't feel that members of the Police Service Board are the appropriate people to discuss the programs that officers are or not taking. I think that question is better directed at the Chief of Police.
Yeah, and at some point, I believe that any group is welcome to ask for a deputation before the Police Services Board. So.
And Councillor Millett, I'll just remind everybody.
Go ahead.
That the Police Service Board operates under provincial legislation, and we have to be very careful. I appreciate Brittany's question, and that should be answered by the folks responsible. We have her contact information, and we can forward that to the chief, and they can provide a written response. We do know they've made presentations both to the Police Service Board in open session as well as council regarding the training that officers take, not just before they are sworn in and work with the Belleville Police Service, but afterwards as well. And so I think, for us to speak on behalf and potentially make a mistake, which then causes legal issues of liability, this is an opportunity for the public to come forward, to express their comments. We're here, we're listening, and that question for Brittany, we can follow up with the chief.
Okay, thank you. And I'll say that most of the other statements that we had and questions were directed toward police. So it is a shame that Chief Callahan decided not to come online with us. One final question that I had that perhaps Councillor Millett will be able to ask was Hastings OPP invited? And if yes, why aren't they attending? Do you know?
Sorry, Hastings OPP? Senator Hastings
Yes.
made up?
Yeah.
No, actually, and again, it was my, I put together I did the invitees to the panel, and I invited organizations where I knew they had programs for mental health workers primarily, because again, the focus was policing and mental health, and I wanted to hear from police agencies that had a proactive program underway for frontline mental health workers with police, just to hear their experiences. And now, as you heard, we have our own starting. So no, I did not. I didn't invite Prince Edward OPP either, because frankly, I was unaware of what particular programs they have, or Quinte West OPP either. So.
Thank you. And before I go, one final question. Will we be able to expect another similar event? It seems as though, some of the feedback that we've been getting through the chat and from these questions indicates the need for another event similar to this one to kind of iron out some of those logistical wrinkles and things that weren't necessarily included. Are you able to commit to something like that at this time?
You know what? This was a bear to get off the ground, as I've spoken to you about. In this fashion, it's not ideal. Obviously, my choice was to have a town hall meeting, and again, it's a decision of council. So I don't know. I can't give you a quick answer. I'm always open for more dialogue. I believe more dialogue is always helpful. So again, I'd love to give you a hard and fast answer, but I will certainly take it under advisement. Again, I'm all for it if we do. Thank you.
Okay, thank you very much, everybody.
Okay, Carol Stevens. Is Carol Stevens in the attendees? No? No? Okay. Christina Lee. Christina Lee, no? Okay. Delaware? No. Delaware had registered. Alexandra Bell. Is Alexandra Bell there? I believe I see her as an attendee. All right.
Hello. Hi. Can you all hear me? Yes.
Yes, welcome. Thank you,
Excellent.
Alexandra.
Yes, thank you so much for the forum this evening and for allowing me to speak this evening.
All right, welcome.
I'm Alexandra Bell, no relation to Paul Bell, who spoke previously, just on record for that. And I'm here representing Anti-Racism Quinte. We're a grassroots organization with members who live in the Bay of Quinte region, and we work to address, learn about, and end systemic racism within our diverse region and its organizations. The reality is that our BIPOC community members have mental and emotional stresses that our white community members will never experience when interacting with our mental health and addiction services, and especially when dealing with our local police. Knowing this, we had prepared to kind of ask some questions, not unlike some of the other participants, but we're really trying to make a statement that we're asking our regional forces and our council to take efforts to increase representation of BIPOC individuals within our community organizations. We were not very diverse tonight on the screen. Myself, I'm not. Our BIPOC community members weren't very comfortable entering this space to speak tonight, and I think that says something that we as community members here in Belleville need to hear and be aware of. So I just appreciate being given a space to bring that up. Also knowing that without proper representation and inclusivity for our BIPOC community, we're asking again for awareness to be brought to what are predominantly white dominated spaces and the way that we need to change their makeup if we're ever going to begin to effectively support the mental and emotional well-being of our BIPOC community members. Mental health and race are just intertwined. It is, especially right now with the way the world is, and failure for us to hear those community members is really us not serving them in our best capacity. So again, I did hear that we're able to follow up with some of the questions for panelists directly, like by sending them. So we will definitely be doing that. But we felt it was very important that the issue of race and the way that it does intertwine with mental health, addiction services, and again, even just in daily interactions in our community with police and the way that that impacts BIPOC members is very important and critical for our council and forum members to hear tonight. So I very much thank you for the time for us to be able to make a statement on behalf of our membership.
Thank you, Alexandra. And I believe a question came in earlier when we were trying to organize this in the last couple of weeks. And there was a question that did we have any participants who were who represented as BIPOC? And at one point we did. One of the agencies, but again, we make every effort, and I think Councillor Kelly, who's the chair of our Inclusion and Diversity Committee, Diversity and Inclusion Committee, we're taking every effort we can. You have to understand that the makeup of Belleville is changing, and we're trying to change as well as we can. But as you look around this group, we're decidedly a bunch of white middle-aged folks trying to keep up. So we're doing our best. But again, I thank you for your representation, and I think we all hear you. Thank you.
And I do appreciate that. And yes, Councillor Kelly and myself have had some great conversations, and I do know that that's a commitment. But again, we can never let that conversation drop, or for us to make the statements that that's something that we're always aware of and striving to be better at. So I do appreciate hearing that as well. So thank you again all for your time this evening.
Thank you. Thanks again, Alexandra, and we'll go to Stuart Gilbert. Is Stuart with us? There he is. Welcome, Stuart. The floor is yours.
Yes. Thank you, folks, very much. I appreciate this. My background is family counselor since 1990, elder mediation since 2016, crisis intervener. I worked at family courts as a support person since 2014. The points I want to raise, notwithstanding what everybody else has said, is we know that down in Houston, Texas, officers are trained and they produced videos of how they operate as police officers first, but mental health crisis workers. Okay, I want to talk about the idea of a ride-along person with police officers responding to crisis intervention calls. Yeah, but you can't do that in a rural area. I understand that. We've had various police officers talking about those kinds of things. One of the big issues is emergency services dispatchers do not appear to clarify the nature of the reason for the call for assistance, such that a crisis intervention response is appropriate. Right now, I'm surveying some dispatchers, fire, police, paramedic in another region to clarify what training do they get. When we hear stories of several officers going to a crisis instead of a mental health worker, it automatically escalates. And we've heard headlines in other cities, not Belleville, but other cities. I think dispatchers need to be trained to ask what's going on, what's happened, and send the appropriate and correct people. That Belleville has 43% mental health addiction calls in 1 month. My goodness, there's a major, this is a wonderful event, folks. We are addressing the problems. This morning at the Quinte West, the Community Safety and Wellbeing Committee did 2.5 hours of a Zoom meeting on mental health and addictions, just that issue, talking about what can we do, how do we quantify it? We're working at it. I'm very impressed that this forum is going on this evening. So you've got my background, you know where I'm coming from and why. I'm surprised it's a council meeting, but that's irrelevant. The point is I have my opportunity to express to you with a little bit of vigor and encouragement that we're working with the police to provide opportunities for them to deal with the right people to deal with mental health and addiction crises. Finally, what about paramedics? They already have some medical training. Might be reasonable for paramedics to get additional training in dealing with mental health and addiction issues to calm situations down and work with people. I'm a crisis intervener. I get it. I get those phone calls at night. Happily, I'm a generalist. I'm not paid by the province to work a 9-to-5 job. With my clients, I work overnight and weekends. They call me because they have an issue and I help calm them down. Okay, I'll stop now. You get the idea. Thank you very much for allowing me to speak.
Thank you very much, Stuart. Always a pleasure, and I appreciate your vigor. Yes, and I think the point you made about paramedics, I think one of our speakers from the police community earlier had mentioned that is part of a model that's being looked at for some of them. And again, this is an evolving issue or an evolving set of skills that I think our police are working towards that integration piece. So, yep, all great points. Thanks so much.
Thank you, folks.
Thank you. We have that's still an attendee and is on our list. We have no. Yeah. Well. Okay. Is Emily Edwards there? All right.
Okay. Perfect. Hello. Let's get me on video.
Emily?
Awesome.
Hi there. Yes.
Hi.
Hi, Emily. Do you have any music in the background or something?
There might be a... Hold on, guys. I have little kids watching a movie in the background.
Oh, okay, okay.
But we can pause it for a second.
There we go. Thank you. Go ahead.
I just first and foremost wanted to say thank you for the opportunity to speak tonight. And I also wanted to thank the council members who have given me their ear and their efforts and their belief behind me. To a few of you, I am the anarchist. I am the noisemaker. I am the person you all were referring to. And this is something that I think is tremendously important that the Belleville community hears and discusses. I was born and raised there, and I recently chose to remove my family from there. But that is not the point of my story tonight. I'm actually coming as a professional who's worked for over 5 years in the HBE area in long-term care. And I want to discuss the impact of housing, mental health supports, and ultimately what police funding has impacted in the long-term care space as a professional, again, who has worked exclusively with older adults and their mental health for the last 5 years. What my superpower is asking people questions. And I really am glad I have the opportunity right now. I want you to all sit and think, what happened to those people when they aren't on the street anymore? Where do they go? When someone has an overdose at QHC, which is extremely high in comparison to other communities, and they survive, but they survive with huge deficits and things that their families cannot meet their needs about, where do they go? It was alluded to earlier this evening that we do have a crisis within the long-term care space of individuals who are inappropriately housed there. We have people living there who are well under the age of 65, who are living with very minimal comorbidities other than existing mental health and addictions issues. What I'm bringing this forward for is I had the privilege of listening to a council meeting many months ago, and I heard the championing of our long-term care workers, and we know how stressed they are. We know how hard our long-term care homes have been hit across not only our area but the country. And I want you to think that by denying the fact that there is a housing crisis and a mental health crisis and an opiate crisis happening in our community, we are now putting the people who we value the most and we consider the absolute most vulnerable at risk. And we are putting them at risk because they are now housed with people who are not supposed to be housed there to begin with. It is not appropriate, and those people are suffering. I dare you to reach out to any long-term care worker in your life, be it a PSW or a nurse, someone in dietary or housekeeping, and I want you to ask them to name someone just in their heads that they know that would be better suited elsewhere for themselves, for their own quality of life, not to mention the other residents and the quality of the work environment for the staff, because there's a constant moral disconnect when you're working in a place where you cannot meet someone's needs. A 45-year-old man with a long-standing history of mental illness, trauma, and substance abuse does not belong within a secure living area for older adults living with dementia. And not at his fault or her fault, at our system's fault. So there are many reasons I could come up here tonight. Again, you've seen my kids. They're Black. We left Belleville because I don't feel that it's safe for them there. I could go on and on. Again, your belief that I am an anarchist and stirring the pot. Actually, I think a professional agitator was the term. However, I am a professional first. And I really, really challenge you all to think right now about who is leading your police service. His face isn't on the screen. There have been multiple people who have asked and suggested that he show up for this, because guess what? Transparency, professionalism, leadership starts at the top. We've yet to hear what happened to the last chief, and I am not impressed by what I see from this one. Again, fortunately, I'm no longer a resident in the area, but again, as citizens and individuals I'll wrap it up. Chris, thank you.
All right, well, Emily, yeah, we specifically didn't want to veer into it was, as you know,
no problem.
Yeah.
But again, I want to say the professionalism. I think I challenge that big time.
Point made.
But
point
again,
made.
I really, again, let's think about where these people end up. Again, people first. That is why we're all here. For the citizens, our loved ones. Let us think what happens to the people that we turn our backs on. Thank you so much, and I will let you all carry on. Thank you.
I appreciate you sharing. Thank you. Okay, that brings us to the close of our session. I don't think we have anybody left on our list, do we? We don't? All right, we have members of council left. Well, as chair, I'm going to turn it back to his worship unless there's any questions or comments that anyone has before we wrap it up.
All right. Well, Councillor Millette, thank you very much for your work, not just bringing forth the resolution that Council unanimously supported, but also doing the work to lead this, to pull together. It's challenging during the best of times, but during COVID, it is also difficult. But I do want to thank everyone for their interest in this topic and all the presenters this evening, all those in the first hour as well as the second hour. This is a very important issue, and we have a lot of smart people who want to improve things. But you know, I do think it's important to highlight some things as well. And unfortunately, we're not alone in struggling to better deal with the rising incidence of mental health, addiction, and other socioeconomic issues that plague our society. The results can be seen in the increased demand for our social service agencies and record calls to our police service. Here in Belleville and elsewhere, the police are the only remaining call that can be made for assistance. These challenges are not unique to Belleville. They exist all over Ontario, Canada, and the world. And at the same time, we want to be more welcoming and accommodating to those who continue to face societal discrimination and injustice. It's important for everyone to be deliberate in trying to understand and accommodate people with different experiences and show them that they are welcome here in our city. Statistics and anecdotal evidence shows that here in Belleville, we are doing better than most. But even small and seemingly insignificant statistics still represent a person whose life will be affected forever. As we continue to grow as a city, there are bound to be more instances that we will need to address. And this forum this evening is a good example of our willingness to identify our problems and challenges so we can bring about the necessary change at the provincial and federal levels. I want to thank Belleville City Council for supporting this approach and Councillor Millette for taking the point on this forum. I also want to point out what has been said many times before. We didn't create these circumstances. Successive provincial governments have abandoned the addictions and mental health services that many of our vulnerable citizens need. They've left them and us without the appropriate resources to treat these people. So we're left to tinker around the edges with programs that we can try to do to improve things. And as a result of that abandoning the addictions and mental health services, the first call and the last hope for many people is to our police service because they're the only resource that's still available. The role of our police service in responding to calls either of assistance or danger is prescribed in provincial law. And we need the provincial government to bring about the sweeping reforms we've been calling on for decades. You know, Belleville City Council, other city councils, police service boards, mental health healthcare professionals, chiefs of police, and police associations all have pointed to the structural problems with policing as it deals with mental health, addictions, and socioeconomic issues. And this action of that sweeping reform needs to happen. But I do want to close on this item, and I think it's important. While we deal with the safety and security of our city, we will work with our Belleville Police Service to continue to make Belleville the safest community in Ontario. And we mean the safest for everyone, including the women and men of our Belleville Police Service, who we ask every day to keep us safe. It's our responsibility to do everything we can to make sure that they get to go home to their families and loved ones after each shift. Policing is changing, not just for the calls that they deal with, but also with the criminals they deal with as well. More sophisticated and organized criminal elements engaged in high value, illegal activities has meant that our law enforcement is understaffed and not appropriately equipped for the work we call on them to do, sometimes with paramilitary crime groups. But yet they go out and do the best job they can, and we're grateful to them for their service. Let's also keep that in mind as we consider all the people who help with this issue, healthcare providers, professionals, volunteers, community groups, and our Belleville Police Service. I know that Chief Callahan and the proud women and men of the Belleville Police Service want to be part of the solution and improvement, and I look forward to the work that comes out of this evening's conversation. Thank you again to everybody for doing this, and to you, Councillor Millette. With that, I will now move to confirmatory bylaw, and I'll ask that bylaw number 2021-54, a bylaw to confirm the proceedings of council at its special meeting held on March the 9th, 2021, be read a first, second, and third time, and finally passed this 9th day of March 2021. Can I get a mover and a seconder, please? Moved by Councillor Alsap, seconded by Councillor Millette. All in favor? It's carried. Thank you, everyone. I'll call for a motion to adjourn. Moved by Councillor Carr, seconded by Councillor Kelly. All in favor? It's carried.